Earlier today, I chaired meetings of the Cabinet and COBRA to consider the advice from SAGE on the impact of the existing social distancing measures. There are indications that the measures that we put in place have been successful in slowing down the spread of this virus. But SAGE also say that it is a mixed and inconsistent picture, and in some settings, infections are still likely to be increasing. SAGE assessed that the rate of infection, or the so-called R value, is almost certainly below 1 in the community. And that means that on average, each person that's infected in turn infects less than one other person. But overall, we still don't have the infection rate down as far as we need to. As in other countries, we have issues with the virus spreading in some hospitals and in care homes. And in some, the very clear advice we've received is that any change to our social distancing measures now would risk a significant increase in the spread of the virus. That would threaten a second peak of the virus and substantially increase the number of deaths. It would undo the progress that we've made to date, and as a result would require an even longer period of the more restrictive social distancing measures. So early relaxation would do more damage to the economy over a longer period. And I want to be really clear about this. The advice from SAGE is that relaxing any of the measures currently in place would risk damage to both public health and our economy. Patrick and Chris will be able to go into further details on all of this shortly. But based on this advice, which we very carefully considered, the government has decided that the current measures must remain in place for at least the next 3 weeks. Now, in terms of the decisions that lie ahead, we want to be as upfront with the British people as we possibly can. So let me set out 5 specific things which the government will need to be satisfied of before we will consider it safe to adjust any of the current measures. First, we must protect the NHS's ability to cope. We must be confident that we're able to provide sufficient critical care and specialist treatment right across the UK. The NHS staff have been incredible. We must continue to support them as much as we can. Second, we need to see a sustained and consistent fall in the daily death rates from coronavirus, so we're confident that we've moved beyond the peak. Third, we need to have reliable data from SAGE showing that the rate of infection is decreasing to manageable levels across the board. Fourth, we need to be confident that the range of operational challenges, including testing capacity and PPE, are in hand with supply able to meet future demand. Fifth, and this is really crucial, we must be confident that any adjustments to the current measures will not risk a second peak of infections that overwhelm the NHS. The worst thing that we could do right now is to ease up too soon, allow a second peak of the virus to hit the NHS and hit the British people. It would be the worst outcome, not just for public health, but for the economy and for our country as a whole. So, the current restrictions will remain in place. The government will continue to monitor the data on the impact of the virus. We'll soon be able to test 100,000 people every day. That will give us a greater understanding of the scope of infection across the country. It will also help us plan how to change the measures when we're ready to do so. When we are confident on these 5 points, guided by the science, guided by the data, we will look to adjust the measures to make them as effective as possible in protecting public health, whilst allowing some economic and social activity to resume. But we will only do it when the evidence demonstrates that it is safe to do it.